Welcome to the continuing coverage from Davos Worldwide and our initiative in conjunction with COP30. And it is my immense pleasure to introduce a dear friend and one of the most brilliant women in medicine, Dr. Karine Sargsyan. She is an inspirational person who has um, made great impact in Europe, in Central Asia, in the US, and is a leading voice for what needs to come next. But to give a brief introduction, obviously a physician and a geneticist. She's currently serves as the director of Inflammatory Bowel Disease Institute and as scientific director of OnCo Biobank at Cedars-Sinai's Medical Center in Beverly Hills, California, managing director for international biobanking and education at Medical University of Graz. She's also an initiator and vice scientific leader and lecturer, the first Bologna confirm MSc biobanking since 2016, the university course Artificial Intelligence in Medicine at Medical University of Graz, et cetera, et cetera, et cetera. So I could spend the entire day reading to you all of the things that Karine is involved in and has accomplished. But before I do that, I'm going to turn this over and say, what is the most satisfying part of having achieved so much?
Well, I don't think that I achieved much, being honest. I think the best things are to come, and thank you for that wonderful introduction. I I didn't expect it too much, and I think that the most important part I'm doing is to projecting what the future holds for us and how to be, in one hand, prepared for the future, and in other hand, how to build a better future. And
You co-wrote a book called Future of the World. You know, tell us a little bit about, what brought, I mean, was that always something you wanted to do, or is that something that developed as your career developed?
you wanted the truth or you wanted a nice story?
That's up to you.
Okay, I'll go with the truth. So I was considered as a candidate for one of the WHO jobs that I didn't got, but because a very good friend of mine got that job and he's definitely much more suitable for. But I met one of the panelists, and you are usually doing some research of the people who are going to ask you questions to understand how to answer. And one of those people have wrote his PhD on future intelligence, and his PhD topic was the world 50.0. And I read about that. I saw a video of him giving a lecture how he did it, and he crowdsourced ideas. And he's a very dear friend of mine now. Hi, Tamash. I hope you are listening. So he crowdsourced from World Economic Forum young leaders what they think how the future gonna look like, and then made his PhD. And I thought I would better work on that than on the position that they are offering. So luckily I didn't got the position, but I reached out to him and I said, you need to enlarge that and do more, and I'm happy to help and I'm happy to be part of it. And then we started together, and we have another great collaborator, Dr. Sangeet Varghese, who joined also in writing. And we added several new interviews on it, and did a huge Delphi. And we wrote a book, and since then I'm working in Foresight Sciences also.
Yeah, no, absolutely. I mean, I think, having read the book, and obviously that all three of you, Thomas, Sangeet, and you are absolutely pillars for us here at Davos Worldwide, and we are so glad to have met you and to have convinced you to somehow to work with us and to become a part of us. And today it is one of those things where I chase don't even think about anybody else. The first three people I call are the three of you, and of course this is Kozlakidis. And the four of you, I think, to me, are the four musketeers. And you've done quite the incredible job in all these areas in healthcare. But tell us, what are you working on now? What is keeping you occupied? What are you focused?
Why I answered immediately to your invitation that I want to do the fireside chat about fragmentation is because being half actually with my genetics, and I don't want to go into, I have very many different genetics, my past says something else, and I work in some other country and so on. I am suffering as a scientist under the fragmentation. And being a doctor, I see that diseases, viruses, bacteria don't know what is a border, don't know what is a visa, don't see any difference between the nationality of the people that are affected by. So if you see the cancer doesn't care if you are, I don't know, American, European, or from Australia. Cancer is everywhere, for instance. So this fragmentation is more on our side as human beings, and unfortunately we haven't found a solution for that yet. And imagine like having a child from Nairobi or from Yerevan or from somewhere in Ghana, having one drop of blood putting into an analyzer and just in minutes analyzed against 100 million genomes or 50 million longitudinal health disease documentation, or a multi-omics data bank, a huge multi-omics worldwide data bank, and getting immediately in 5 to 7 minutes the results of the blood test and the possible cure. That is a dream. But unfortunately, we have a huge fragmentation to make that dream possible. I think in 5 to 7 years, we would be able to do it. And even now, technologically, the most part of that dream I brought up is there already. But what we don't do is connecting. And that is something that we need to work on, especially in medicine, because we and especially in medicine, where one part of the world has all the possibilities and the other part of the world needs to have at least the basics.
Yeah, you're so right. As you know, we worked a little bit on the sickle cell side of it, and what was really shocking to us was to see that what is, of course, a rare tropical disease classification in Europe and the US or in North America is a epidemic level disease in Africa, in sub-Saharan Africa, in the Middle East, and most surprisingly in South Asia. And we started to kind of look at it, and it was again the same thing, and just saying that because it was assumed that the people in India had a different genome, or the people in on the Arabian Peninsula had a different genome, that this would not be something that would affect them, and that's why it was largely ignored for years and years and years. And so it's very interesting, as you mentioned, your I want to say Austrian Armenian is the most close I can get in geo in this. Yeah, but we all know that in Central Asia, genomes have been mixing for years, for millennia, right? So there is nobody that can say I am this, because that doesn't exist. In India, we find this when people do their genetics and they find, oh, I have Greek blood in me, or whatever, So it's so convoluted. Yet, yes, of course, the artificial boundaries are something that are, inhibit scientific research and truly creating global solutions. So, what do you see the role of AI in doing this? Because AI is, of course, helping the technology side of it in being able to bring this forward.
Um, well, may I start
Yeah,
a step back?
yeah.
Because, as I said, the viruses and bacteria doesn't know the borders exactly like that. The genome doesn't.
Mm-hmm.
So when we have now several countries that are that have their borders, have their own culture and everything, the genetics doesn't know those borders. Countries are social concepts,
Yeah,
social, economic, political concepts, but not biological concepts. Biological concepts are races. Biological concepts are the actually the adaptation of our genome to a specific climate. So if you would look at, for instance, my husband's genetics, it would show very much nowadays Turkey, which was Great Armenia back then. So in the reality, those mixtures and everything that we speak and we try to check from where we are coming, it shows only the geographical part, not the political. So what we need to think more is global. It people doesn't. I don't think that people have mixed much after Babylon, but I think that seeing how we are concentrated in this political, social aspect, we need to open up. We need to understand that the cancer, for instance, affects breast cancer, affects a woman in Los Angeles exactly the same like in Mumbai, and exactly the same like in somewhere in Costa Rica, for instance. And very much possible that we can learn how this or that patient was treated for the other one very fast if we can connect. But this connection, and it has two aspects. One is really geopolitical, and the other is competition in science, which is incredible. So collaboration and kind collaboration, open collaboration in medical research is, on my opinion, the only answer to nowadays challenges.
Oh, I agree. But at the same time, I think there are steps. If I mean, I've been to several medical conventions, and I would say that physicians tend to have very open discussions with
Yes,
each other,
yes.
and they are genuinely not concerned about anything other than actually sharing information. It seems to be almost part of the just the makeup of physicians in general and researchers, and they revel at being at having these discussions, and then these are discussions that light them up. um, Me not being a physician found them quite, boring after a certain point. But that being said, I mean, what I really gained from all of these conferences that I went to is to see that there were groups of people having discussions about a particular disease or a particular thing, and there were conversations happening that had nothing to do with where they came. It wasn't about the country of origin. It wasn't about anything. It was the disease they were talking about. And the disease was universal. It didn't matter, who they were and what they were. So is the block? So we know that physicians want to share, and we know that physicians want to do this. But now we have two or three problems. Well, our biggest problem today is data is monetized.
Yeah.
So because data is monetized, data now is not freely available as it was 2 decades ago for research. Today, any institution, any university, they are guarding their data. They're no longer looking to share the concept of that the internet was created for, which was to share scientific data, is the one thing that we've gone away from in doing everything else on the internet but the main concept, which was sharing information. So how do you fix that?
Um, well, if I would know how to fix it, would be already fixed. But there are some possible approaches that we have. The one approach is to support good quality scientific research as much as possible, and to support not only like we have multi-center studies, we have multi-PI studies, we need to add multi-country studies.
Mm-hmm.
We need to add, like, I'm trying, when we do a research, I'm trying to add low and middle income countries in all my projects. There are some groups from low and middle income countries to approach the problems that they have specifically in their countries that we might not understand at our side of the world. Yeah. So to open up and maybe institutionally add that to funding calls for research. This is one thing. The other thing is to intensify the discussions that you found somehow boring, but to do that like here in an online platform where we can combine and open up for everybody who want to listen, who want to learn. So to do open-end education, I think that would be very, very, very helpful, in my opinion. And the third thing is specifically for women in all over the world, not only in low and middle income countries, not only in developing world, but also here in US. I mean, for women, we need to have mentorship, 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 support, support, support. And that would be my answer to that. And maybe, predict about, like, speak open about that all the time. Yeah.
Yeah. I think that you've hit on a good issue of women in STEM, right? I mean, it's something that over the past 15 to 20 years, there's been a lot of focus on and saying there needs to be an increase, and you see that organizations have worked, in towards this, and there is definitely progress, not of course as one would expect, and not necessarily exponentially, but there is small amounts of progress. I would say this to you: we are educators in India. We have some schools and stuff like that, and grown up around education, and you see consistently more and more women, young girls, not only embracing science but excelling at it. And it just almost seems like because there was a bias, they were not promoted before. And if we look at kind of where things are today in every discipline from medicine to engineering, in the STEM side of it, more and more women are part of what used to be traditionally very male majors, as you would call it, and very major, male dominated disciplines. And even when I was in university, there were very few women in engineering. There
Yeah.
were lots of women in medicine, but generally it was almost expected that there would be OBGYNs, and that was going to be the track, right? And that was why they were doing it, is because women
And
need women
and
doctors.
and pediatrician, and that's it.
That's right. Yeah, that's it. I mean, that's pretty much that was the extent of it. And now you see a lot of women in research. You see CEOs in medical companies that are that are women. You see a lot more even bankers, at senior levels. That wasn't a thing, even 25 years ago. So I think there is progress, but on coming back to fragmentation, I mean, certainly when it comes to gender bias and it comes to, these kind of problems, this also does create a dearth in data,
Yeah.
because if women are not being provided in, proper health care, and their numbers are not being added in, then you don't have the right data. So what are your thoughts on this? I mean, is it an access thing? Is it just increasing access for women? Is it more, how do we, kind of take these things forward?
Funny question, and not really very funny, but actually, I investigated for a book to see when this parallel universe for women started to exist, and that is actually 100, maximum 150 years old. In Stone Age, women and men had the same rights. And they were actually very similar, and nobody has started to discriminate on gender, and the discrimination from gender perspective, not only in research but generally, that we needed the quota came only 150 years ago, but the systemic research started also around 150 years ago. So if you look through the medical research and the whole clinical studies, most of the clinical studies are done for male, and most often for white cisgender male. All other people, unfortunately, and I'm smiling because otherwise I would cry. Unfortunately, all other people, the half of population, were excluded. Children were excluded anyway, and then the women, and then all other men too. And the clinical studies were first done for them. I don't know why, but I know that there is a big shift towards the right proportion of everything. Nevertheless, that's gonna take us another, or my opinion, another 20, 30 years, because human beings are used to say we have always done it like that. And the change is very slow. I would love to see faster change, and with the help of AI and machine learning, we have seen so many things, because machine learning in medical research and also AI gave us the opportunity to see into the mirror, to look into the mirror and to see what we are doing wrong. Why? Because AI would learn from the last, let's say, 20, 30, 50 years of the data that we produced, and then somebody would write a paper on AI is racist. And then if you go through and understand why, you would see that the decisions that AI made were based on the data that we human beings have had in the last 20, 30 years. And then I want to cite from Solaris, from Stanislav Lem, we don't need more words, we need mirrors.
I mean, that's right. Yeah. I know, but talking about, coming back to the main fragmentation thing, what role do global organizations like the World Health Organization play in this, and what could they do better to do this?
Actually, they do pretty much to change that.
Hmm.
There is a World Health Organization academia. So academy where they are open up, giving lectures to anybody who register, and trying to just close the gap of education in not only healthcare but also healthcare research and medical research and biotech research, which is actually very popular even in everywhere among my students, and I'm giving lectures meanwhile in 19 different universities. So even students know that there is an academy of World Health Organization and they do well in one hand. On the other hand, the standards that the global organizations are developing are one size fits all, and that would be nice if that would be customized to local circumstances. I would very much support that idea, that also like the diagnostics for inflammation, there are some countries where low-grade inflammation is still normal, but we have one standard of C-reactive protein, how much is normal, and then the half of a specific country would be then ill, which is the local researchers know and doctors know, but I would customize even these kind of things. This is a small background thing to going to high scale research done on different countries. If I take my background, like of the job that I have done in Europe, was large scale biobanking, and the based on the work I'm doing now, like for instance, I'm heading the advisory board of Nobel laureate Ferenc Krauss, who is doing the molecular fingerprinting of our plasma. Well, he got his Nobel Prize for Physics for attosecond light movement measurement, but the justification why it is worthy of the Nobel Prize was because with that attosecond light, you can measure the general movement of a human plasma in one drop of the plasma, which can predict or differentiate a non-infection disease, non-communicable disease with a healthy against healthy. So you could see and predict if a person in coming years will develop a heart condition, a cancer, a COPD or asthma, and so on, which is rather cool. Because I mean, usually you see that in science fiction, or you read that in science fiction. So, and this kind of research shows that there is no difference in human beings.
Yeah, absolutely. No, and so I think we come full circle to the same thing, which is just saying that disease doesn't know borders. Disease doesn't understand politics. Disease has nothing to do with religion. Has nothing to do with anything else. It is purely its own thing, and it affects all of us. And of course, as you said, there are local diseases. I mean, comorbidity in certain areas is influenced by local diseases, but then physicians in local areas know that. And they guard against that. So there is knowledge. It's just knowledge is fragmented still, and it's not coming together as well as it should. And the only time it's coming together is if there's a profit potential. And then, of course, everything works really well. So if you can do a drug discovery on it, or if you can come up with a device that does this, then of course it's super simple. Everything works because there are investors and there's money and there's whatever. But for research perspectives, what is the role of government in this? I mean, we've seen recently a pullback on NIH grants here. We've seen some other areas in the world that have pulled back on medical research. How does that affect true research?
That affects a lot. Actually, traditionally, governments are the support for research and the funder of research mainly. And without research, there is no future. The researchers are building the best future of the world, and putting a stop on a break on funding the research would mean keeping us in the same level of development and without allowing to evolve. And human nature is very much in need of evolvement. And also, we see that we understand more and we can do more. And on one hand, this is very tragic, in my opinion, that we have had step backs because of funding. On the other hand, I think there is another type of human beings like the mecenats and the people who fund research from their own pocket because they understand the need. And some of these big grants that lost their funding got money from known people, and I don't want to make any advertisement because otherwise I would name one and forget the other. But some of grants just were covered within 2-3 weeks.
Yeah, but
Because
Karina, that doesn't solve the problem, right? I mean, because
exactly,
even if you have, even if you look at pharmaceuticals, the pharmaceutical business, they don't fund a lot of preliminary research. Preliminary research has always been academic, it has been government sponsored, it has been whatever. So the building blocks of research, because if that building block is not done, pharma doesn't see anything. There's a void.
exactly, absolutely. So uh, although the human beings have the kindness and possibility to help, that is not solving the problem.
Yeah.
Couldn't agree more. The problem solving would be all the countries, on my opinion, should give a huge part of their GDP to the research. And it's not only medical research. I would love to get the big part of the cake, the big piece of the cake to medical research because I am in that. But it's physics. It's like, for instance, semiconductors, for instance, the space research. And in this case, I would still go in because there is a space medicine too, but it is also the research in AI and machine learning and how to make it more precise and better use and not only just chat with ChatGPT, which is also fun, okay, but they can be done so much in like fluid crystals computing and so on. So we have so much to do, and cutting on the research is the most sad thing that can happen to humanity, in my opinion.
Right. But the thing is, at the end of the day, if you look at it and you say, okay, uh, research continues in other countries, research continues in other areas. However, traditionally, those areas have not shared information, are very much protective of their information. So when you get into this situation, it becomes quite complicated as to not, but there is some parts of the world where there is research happening, and it's happening furiously, and governments are funding research, but that's not being shared, and that's not open information, and it's difficult to be able to kind of work on that, even though certain parts of it is now becoming more and more available from China and from other parts of the world. I don't want to pick on any country, but if there is one side that says I don't want to do any more research, it certainly does set us back, and that fragmentation that we talked about becomes even more fragmented, because at the end of the day, without funding, there's no way to conjoin all these various areas. As you yourself said, you are now working with a physicist, a Nobel laureate, right? Has nothing to do with medicine in its essence. However, it's an application. We're building tools, right? We're not necessarily building one specific thing. Yes, we can build a drug, and that's a procedure, and that's a process, and it goes through a process, and that's one thing. But something that happens like this, which then helps us do something so vital in being able to separate from plasma what the non-communicable diseases are, is just, it's like you said, science fiction. It's but that's the reality. So we're a little bit over time, Karina. So this has been absolutely amazing. I look forward to us doing this again. And I think that you are absolutely right. And, one of the ideas that we have been thinking about is to actually do more meaningful collaborative work that is specific to industry, specific to learning, specific to knowledge, yet multidisciplinary,
Yes,
right?
exactly.
And so, for instance, the next thing we are planning to do is something on critical minerals and processing and mining, because it is so complicated and so all over the place, but it is a very multidisciplinary field. And so I think that one of the things we should look at as curators of both of us curators of Davos Worldwide is to look at medicine and to look at see how we can make this better and how we can build a little bit better future. Yeah,
May I make a comment
of
on the
course.
mining?
Yeah,
Don't forget the medical and healthcare aspect in mining.
very much. Oh, no, no.
And
Yeah.
and I have now I'm working now on a big project which is, I hope, will be funded, that is looking to short-term and long-term effects of mining industry. So don't forget that part, because that is a huge part of the
Oh, it's a
mining.
huge part. We've gone from days. I mean, I can honestly tell you that I have in my lifetime visited mining sites where mine workers, were drinking from slurries that were so toxic that they should not be around it, yet that's what they were using as drinking water, for bathing, for everything. And you looked at it and you said, this is, so things have gotten better. But of course, healthcare is has a big impact, because mining has a big impact on the entire the ecology in the area. And then, of course, and long term, it pollutes water, resources as well as other resources across the board. We find iron ore mining, and then people say, oh, it's surface level mining. It doesn't do, but the wind that carries the dust, and that dust contaminates across the board. It does again. The body doesn't know. The dust doesn't know that this body is good and this body is bad and this is rich and this is poor. That dust that goes up into the air, and that people can't see. It's the stuff that doesn't see you that kills you, right? So that you can't see that kills you, right? So, and it's quite interesting. Yeah. So no, it would be another area we should definitely look into. But going back to fragmentation, final thoughts.
Final thoughts, the fragmentation is, on my opinion, the real death of the research. So we need to stop it to have great medical research on planet Earth, because we need it urgently.
Done. Okay, so we will leave it at that. Karina, thank you so much for your time. I know you are super busy and super, so it's traveling. As you said, is it 19 now? 19 places you're lecturing.
Yes.
Okay, so and these are all over the world. All right, so you are constantly on doing something. Not to mention, of course, your major role at Cedar Sinai in Beverly Hills. So wonderful. Thank you again for your time, and look forward to seeing you on the program again as we look at digital healthcare.
Thank you
Thank you.
very
Have a
much.
great day.
Yeah, you too.
Bye
Bye.
bye.